We're here visiting Pahrump to provide information to the community. Our function as a state agency is to provide information to consumers regarding healthcare issues. Some of the services we provide is advocacy, providing information and education on insurance plans, workers' comp issues, any issue related to healthcare that a consumer needs assistance with in resolving. If they're unable to resolve that issue, we're able to intervene on their behalf to try and resolve that for them.
Is this for public and private insurance companies as well as, cash paid?
It's for any consumer in Nevada who's having problems with, for example, insurance companies, or if they're having claims issues with their workers' comp, or issues with their business insurance. If they need some assistance with that, we're able to intervene. So it's the community at large.
How many times have you guys been here before?
This is actually our first visit. We're in the midst of a rural tour. We've gone through some of the communities in southern Nevada, and this is our final stop, and we expect to come here more often. We're going to make more frequent visits to Pahrump because there is a need out here for a lot of the services.
Yeah, especially because we're kind of an isolated community.
Exactly, precisely for that reason. The reason that we're hitting all the rural communities is because the resources are limited, so we're doing our best to try and spread the word about what is available and what we can do on their behalf as well, should they run into any problems, those consumers.
I know that you organized this. You also invited some other organizations out here.
Sure. We invited members of the AARP. We've got the Senior Medicare Patrol Program here, and we've got members from SHIP who help out with Medicare issues as well. So, they've been great partners with us. We partnered with them this year, and we've got more agencies and more organizations coming in. So we're growing, and as that happens, we're going to throw more events. We'll be going to towns more frequently and bringing everybody along with us.
What's some of the most concerns that you hear from consumers?
A lot of the concerns have to do with denials, either of workers' comp claims. There's billing issues. The primary is the billing issue. We've got issues where there's hospital or provider billing issues that the consumers are questioning. They're not sure if they're being billed correctly. So what they do is contact our office, and what we do is we'll go in there and audit that bill, or we'll discuss the issue with the hospitals or the provider to determine the legitimacy of all the charges that are on there. And once we've resolved that, then we report back to the consumer. It's either in the positive or negative. If we're able to negotiate something for them to pay back that bill, should it come to that, we can do that as well.
This is a great program. What is it funded by?
We've got several funding sources. Currently, we were approved by the Healthcare Reform Act. We've got funding from that. That's going to help our agency grow. We get funding from Medicaid. We get funding from the DIR, from the Division of Industrial Relations, for the workers' comp portion of it. So there are just several sources. We're at, you can contact us at 702-486-3854. That's my direct line, or 702-486-3587. Or get on the website at govcha.state.nv.us.